Have you ever heard of pain that just appears? With no injury, no reason. Pain that feels like it has a mind of its own? Well, that's neuropathic pain, and it's one of the most confusing and difficult conditions out there. Today, we're going to dig into this faulty alarm system inside our own bodies.
You know, when people who have it describe it, they use words that sound more like an electrical problem than a typical ache. Burning, pins and needles, electric shocks. These aren't just descriptions, they're huge clues. They tell us the problem isn't in the muscle or the bone, but in the very nerves that are supposed to be sending the messages. It's like a signal without a source, a message with no real meaning.
I mean, it's a really wild question, right? Just think about something like phantom limb pain. Someone can feel this intense, agonizing pain in a leg that isn't even there anymore. And this isn't in their head, it's a real, raw signal from a system that's just gone haywire. So how does our body's own alarm system get its wires crossed that badly?
Okay, so to really get what goes wrong, we first need to look at how it's all supposed to work. Let's take a look at the blueprint for our body's normal, everyday pain response.
So here's the official definition. The key phrase you got to lock onto is somatosensory system. It's a bit of a mouthful, but it just means the entire network that's responsible for every single thing you feel. Touch, hot, cold, and, yep, pain. So neuropathic pain isn't an injury in the usual sense. It means the network itself, the actual wiring, is damaged.
Now, this slide is perfect. It's basically a roadmap for a pain signal. Let's follow it together. Imagine you touch a hot stove. That's the trigger, right down here at these receptor endings in your skin. Instantly, an electrical message just shoots up this wire, this nerve fiber, right into your spinal cord. From there, it's like a high-speed elevator straight up to the brain, and the brain is command central, right? It processes the signal and basically yells, "Whoa, that's hot, move your hand." That's the alarm system working perfectly, doing its job to protect us.
So, way back in the 60s, researchers came up with this really elegant, almost simple idea to explain how we manage pain. They called it the gate control theory. Imagine there's a gate in your spinal cord. When you stub your toe, that gate swings wide open, letting that ouch signal rush up to the brain. But what do you do right after? You instinctively rub it, right? Well, that rubbing sends other non-painful signals that actually help close the gate, which quiets down the pain. This theory is so important because it tells us we have a built-in volume control for pain.
Okay, so if we have this amazing system of wires and signals and gates, where does it all break down? Well, the fault can pop up in two main places. We can basically split these failures into two big buckets. On one side, you've got peripheral pain. That's when the damage is out in the wires and sensors themselves, the nerves in your arms, legs, all over your body. On the other side is central pain. That's when the problem is in the central processor, the spinal cord or the brain. Both trigger false alarms, but where they start from is totally different.
So let's talk about some real-world examples of peripheral pain. After someone has shingles, the virus can actually damage the nerve endings, and that causes that awful, persistent burning pain. Or with diabetic polyneuropathy, when blood sugar is high for too long, it's basically toxic to the nerves, especially in the hands and feet. That's what creates that classic stocking glove feeling of pain and numbness. And there's phantom limb pain again. The nerves were cut during an amputation, but they just keep sending out distress signals. See? In all of these, the problem starts out in the peripheral wires.
All right, now let's talk central pain, where the issue is right in the command center. After a stroke, the parts of the brain that read pain signals can get damaged, and they might just start generating pain out of thin air. A spinal cord injury can create like a permanent roadblock for information, and that results in a constant faulty pain signal. And in something like multiple sclerosis, the protective layer around the nerves in the brain and spinal cord gets attacked, which causes all the signals to short circuit and misfire. Here, the central processor itself is the source of the false alarm.
So, understanding the problem is step one. Now for the really important part, figuring out how to fix it. How can we possibly quiet down these misfiring nerves and mute the body's false alarm? The way we approach treatment is actually super logical when you think about our alarm system analogy. We've got three main strategies. We can try to calm the super excitable wires down right at the source. We can try to block the false signals so it never gets through. Or we can find a way to manually shut that gate in the spinal cord to keep the message from ever reaching the brain. All right, let's open up the toolkit. For strategy one, calm the wires, doctors often use meds you might have heard of, like gabapentinoids or even certain antidepressants. And what's wild is that they aren't just for mood. They actually work by turning down the overall volume on an overactive nervous system. Then, for strategy 2, block the signal, you can use things right on the skin. A lidocaine patch is pretty simple. It just numbs the local nerve endings. And a capsaicin patch, yeah, that's the stuff from chili peppers. It basically overwhelms and exhausts the nerves until they give up and stop sending those false alarms.
And for our third strategy, closing the gate, we can bring in some really cool tech. Let's go back to our blueprint for a second. A spinal cord stimulator. This little device here is implanted to send tiny, non-painful electrical pulses right to the spinal cord, exactly where that gate is. Remember the gate control theory? Well, these new pulses create a different sensation, like a light tingling. And that sensation basically closes the gate on the pain signals. It blocks them before they can ever get to the brain. It's pretty incredible stuff.
But what happens when this faulty alarm goes off in a nervous system that's still developing? Neuropathic pain in children, that is a whole other level of challenge.
I mean, think about it. Diagnosing nerve pain is hard enough in adults who can describe these strange feelings. Now imagine a kid trying to find the words for it. It's so tough, and it often leads to really long delays in getting the right diagnosis. And on top of that, doctors can be hesitant to use the necessary medications, which can lead to underdosing and the child just not getting the relief they need.
Kids can get nerve pain from all sorts of things, but here's the really hopeful part. A child's nervous system is incredibly plastic. That means it's still growing and can be rewired. This is why treatment is often this big, holistic approach. It combines medication with physical therapy and powerful psychological tools like cognitive behavioral therapy. It's not just about turning down the pain, it's about actively helping the child retrain their brain's response to it.
And that brings us to one last, really fascinating question. Neuropathic pain teaches us that pain isn't just a physical feeling, it's information, it's a signal. And if it's a signal, then it's basically code. As we learn more and more about the language of our own nervous system, you have to wonder, maybe the ultimate goal isn't just to block the pain, but to actually rewrite the faulty code and reprogram the system itself. What do you think the future of treating pain even looks like?